there and welcome. Today our topic is menopause and I am Dr. Susan Raschal, aka Dr. Seuss, and this is my esteemed colleague Dr. Rena Azar. And as I mentioned, today we're going to be talking about menopause, but know that there's going to be several other topics that we'll be discussing and going over over the next weeks, months, and years.
That overlap with or branch off of menopause.
Exactly. So today it's going to be menopause, and I am going to tell you that we personally have experiences because we've both gone through menopause. And I'm just going to give you a little tidbit, and that is there are 3 types of menopause. There is natural menopause, there is surgical menopause, and there's also chemical menopause. And these are not completely inclusive, but these are the 3 most common types of menopause. And I actually experienced 2 of the 3, and neither one of those were natural. So in my early 40s, I went through menopause because I had breast cancer and had chemotherapy, which put me in chemical menopause. And then I had a hysterectomy as well as had my ovaries taken out. And that's something else that Dr. Azar at some point is going to be talking about is what is a hysterectomy, and does that mean everything is taken out or just some things are taken out? But that is going to be a topic for another time. But I went through menopause as I said, chemically as well as surgically, because I went through chemo as well as surgery. And I had the common symptoms of night sweats and hot flashes, which were awful, as well as some fatigue and some probable mental changes, meaning that my memory wasn't as good as it had been previously. But honestly, I didn't know how much I could account for menopause or for the chemotherapy, because there's something called chemo brain, which again, we'll talk about in another one of these upcoming videos. But meanwhile, menopause. So Dr. Azar is going to talk about more of the specifics of menopause, what it is, who it affects, how it affects them. And one thing that I do know is that my mama was 55 before she went through menopause, and women typically are 51 or 52 years old when they go through menopause. But I'm going to have Dr. Azar take it over from here.
Okay, so what is menopause? Menopause is the time in our life when our ovaries quit working. They quit producing hormones. And the main hormones that ovaries produce are estrogen, progesterone, testosterone. We're going to focus a little bit on the symptoms related to estrogen because those are the symptoms that most people find relief with estrogen replacement. And in another talk, I'll be talking about various types of hormone replacement, pros and cons, and various types of hormones that are affected by the menopause time. So menopause technically refers to that time in your life when your ovaries quit functioning. Obviously, we probably know, everybody does, that will be associated with lack of periods. Your periods should stop when your ovaries shut down. And one little note of importance is that if you've gone through your change of life, your menopause, and if you start to bleed again or you persist in bleeding, then you need to see a doctor, because sometimes that is a sign and symptom of cancer, basically. So it needs to be investigated. It's not always cancer, but it can be.
And that is one of the reasons why we tell you to know your body and pay attention to those signs, because honestly, it could be life-saving. And one of the things that we talk about, or that we know personally, from my point of view, is I found the tumor in my breast on my own from doing self-breast exams because I knew my body. But the other thing that Dr. Azar continues to go over with her patients is to note something that is different and something that doesn't seem normal. But also, if you suspect, if you get that little, I call it the little bell that goes off inside of you that says, this doesn't feel right, take it to an expert.
Absolutely, absolutely. I'm surprised how often my patients are right on with their intuition about something being wrong. So menopause is that time where the ovaries shut down. Perimenopause is kind of all the time period around that time, because most people don't just notice one change in their body, they notice multiple changes as the ovarian function decreases over time. So that's the perimenopause. Post-menopause is technically after your change of life. How do we know you've gone through your change of life? If we look at a clinical scenario, which means if we just look at how you present as a patient without doing any specific testing, we kind of define menopause as 1 year of no periods. Okay, so that will usually mean that you're menopausal. If that occurs for you quite early on in life, then we like to do a test and see, is this indeed, like, so let's say that occurs at 30. Well, we need to check that out and see if you're an early menopause woman. Yeah. But other times we kind of are interested to know, where are you at in that spectrum of change? So sometimes even if somebody's still having periods, maybe they're changing, maybe they're having some hot flashes, but their periods are not changing, and they may want to know, am I menopausal or am I getting close to menopause? And it's helpful to do the lab work that's associated with that, which includes an FSH, an LH, and an estradiol level, which your doctor...
again slowly.
FSH, follicle stimulating hormone,
right?
LH, luteinizing hormone,
right?
And estradiol. So those are 3 labs that we can do to determine, are you menopausal? And if not, it can give us an idea about how close you are to menopause. It's not exact, but it can give us a good idea.
One of the things that I do want to say about labs is, and I suspect that Dr. Azar has experienced this, as have I, and that is when, because we are incredibly good at developing an excellent rapport with our patients, so then what happens is they will bring in all their labs that they have gotten from other doctors. Be kind to your doctor, because when someone shows me these hormone levels, I can talk a little bit about them, but I'm telling them, you need to talk to Dr. Azar, because that is not my area of expertise. And even if the doc that you take it to can explain some things, like I can explain some things, there are some subtleties in those labs that she will be able to identify and be able to provide additional information to you. So it's incredibly important that you take it to the expert. And also be kind to your doctor, because that is not necessarily their area of expertise. So I don't want you taking those labs to them, expecting them to interpret them because they take the time with you. And Dr. Azar and I are the type of physicians that take time with you. But again, be kind to your doctor, and you want to maximize their gift set. And their gifts are not necessarily, my gift is not gynecology. So you want to take those labs to Dr. Azar. Okay.
That's a good point. So one question I get is, do I need to check for menopause? And my answer is no. If you go through menopause and you're not having problematic symptoms, or if your menopause is very classic, you're approximately 50, you're noticing hot flashes and night sweats, you're having some changes in your periods, we can assume, hey, you're probably menopausal. And if you want to seek some treatment for it, we can do that. Sometimes it's helpful to know if you're post-menopausal or not. But we don't always have to test. Sometimes we can treat. I will have another series on hormone replacement. We'll talk again at another setting about types of hormone replacement, also about types of things that we can do that are not specifically hormonal for menopausal symptoms. So what are menopausal symptoms? Most women will tell you they know the majority of them, either from their personal history, like us, or from somebody that they love. They've heard it from somebody they love. So hot flashes.
And there is something that I think is comical, but when I go through the hot flashes, for some reason, and I don't know if you found this, I feel compelled when I start taking my jacket off or something, I'm having a hot flash. I don't know why we feel compelled to do that, but I watch other women do the same thing. So, gentlemen, don't be upset with your wife when she says, I'm going through a hot flash. I think that's more for us than for you.
Absolutely. So, hot flashes, night sweats, mood swings, sleep changes, usually insomnia, but not always, skin changes, dryness, etc., different texture change of the skin, memory changes, kind of an exacerbation of arthritic type symptoms oftentimes. So these symptoms are variable. As with all processes in human beings, everybody experiences menopause symptomatically differently, different set of symptoms. And some people have no symptoms. I have women come in and their periods quit, and I test them and they're menopausal, and I tell them, do not tell your friends.
That's right.
You will lose friends over that one. So most people have some symptoms, and oftentimes people will seek hormone replacement or other types of treatment for those symptoms. So we'll talk about that later, but an important thing I like to discuss with patients is what to expect in the menopausal time period. Everybody does things a little differently, like we've referred to before. One way that people go through menopause, I have some people do the cold turkey menopause. They hit 51, their periods stop, and all of a sudden they have hot flashes, night sweats. People who have a sudden cessation of their periods, sudden stopping of their periods, sudden drop off of their hormone levels tend to be a little bit more symptomatic. They will oftentimes come in with big eyes and feeling like they are just going crazy with hot flashes, mood changes. Oftentimes they have been sent to see their doctor by a loved one who says, please go see somebody. You are not yourself. I've heard that so many times, you can't believe it. So that's one form of menopause. Another transition that I see frequently are people that do it kind of gracefully. They basically have a slow dropping of their menopausal symptoms. And so their periods will become a little lighter, a little more spaced out. They might have some little hot flashes and night sweats, mood changes, etc., but they're very gradual. And that slow drop off of hormones is very well tolerated by the body. So those women oftentimes will gracefully pass through menopause and never seek hormone replacement. They'll just gradually transition. And then I have what I call the sputterers, which is what I was. Basically, the ovaries kind of are working normally and then they slow down. Then they work normally and they slow down. So people will have years of or months of maybe a change in their periods and then they're back on track. Some hot flashes and then they go away. So sometimes we treat people like for the duration of their menopause or not at all during their menopause or during the sputtering episodes. So it's very highly variable and you need to get a doctor that will listen to you and will follow you closely and decide what's going to be the best form of treatment for you. And as I referred to before, I want to make a couple comments that I want people to know. One is that if your periods are becoming heavier or longer, that's not normal in your menopausal time period, which is in the late 40s, early 50s. So if that's happening, you need to get in and just make sure that you get looked at and evaluated to rule out any kind of uterine cancer, because that is sometimes how uterine cancer presents. Some people do that. We don't know why, but sometimes it is uterine cancer. We don't want to miss an opportunity to detect that. Another thing that is...
The thing that I wanted to comment there is it's incredibly important that if you notice something that is abnormal or unusual and you feel like it is inside of you, is telling you something isn't right, make sure that you take it to your Dr. Azar, to your expert, because there may be something there. And I would much rather you err on the side of caution and they say, yeah, it's nothing, rather than ignoring it. And then when it's diagnosed, it is in the late stages of cancer or something else. So it's really important to listen to your body and follow through with it.
And we're going to have some video sessions with some of our patients that we adore, patients that we've been through problematic things with. And oftentimes those are patients that came in with a gut intuition about something being wrong, and they were right. So there are a lot of good lessons to learn from people, from patients, from situations that present.
The other thing that I wanted to point out is that sometimes the medical literature is not as up to date, if you would. So one thing that we have learned is historically, most of the research studies have been done on men. And I don't know if it was because, and I think the reason for that was because women got pregnant. And you don't want to put a pregnant woman in a research study. If something happens to the baby, whoops, that could be a problem, and they're going to blame the research study. So there is not the amount of literature on women's issues as there would have been had we started doing research on women many years before. But be that as it may, one of the things that Dr. Azar has shared with me is that with some of these symptoms are not, the data does not support some of those common symptoms that she has seen, but having the beauty of someone who thinks globally is that she listens to her patients and has for over 25 years, and what she has seen is symptoms that represent themselves or are repeated in many of her patients. So she doesn't just practice evidence-based medicine, which she does, but she also uses her experience to help guide and direct a patient in what they're feeling and thinking. So if you have a piece of literature that doesn't show that a person's memory is it can be a problem. So that's why it's important to seek out the expertise.
One last point I want to make really quickly. We're getting lengthy on this one, but I want to point out that osteoporosis is a condition of thinning of the bones, which we know in a woman is at its peak during the first year of menopause. So if you're somebody who's prone to osteoporosis familially, people in your family members with it, or people who are very petite, or people who are smokers or have had prolonged steroid use or heparin use, some of the medications that we will review in another series on osteoporosis, then that's a reason to go seek medical evaluation to make sure your bone density is being stable during that time in your life. And I will wrap it up now. And thank you so much for your time and your attention.